Who is an ideal candidate for beard hair restoration surgery? In my clinical practice these days, I come across so many young boys, young patients coming to me for this very purpose. So I thought of making a video on this particular topic because that's very important. I am Dr. Shaiil and I am a hair restoration surgeon who has been practicing for almost 20 years now. All of us compare ourselves with others, especially teenagers when they are in their growing years. They idealize somebody, some celebrity who has a very thick, lush beard. When they see their friends in the class, colleagues having good beard, they envy them, and they just want to get that beard and almost ready to do anything for that. So who is an ideal candidate for beard restoration surgery? Coming to the topic now, beard keeps on growing till the age of 23, 24, sometimes even 25. In some families I have seen this, the beard growth is delayed. It is not something which is exactly going to happen in the bracket of 15 to 20 years. In some people it might happen, but not in everybody. So ideally you should wait till the age of 25 years, see how your beard improves. Sometimes we add some medication for that. I have made a separate video on the treatments, medical treatments, and some home remedies which you can do to improve your hair growth. So if you are having a genetic problem when there is no growth in this area, then you are a good candidate for hair transplant surgery, but after waiting for some time. If you have hormonal problems, hormonal issues, you must get yourself investigated by an endocrinologist or a dermatologist and see if you have any hormonal issues. Low testosterone levels can lead to less beard growth. So if that is the case, treating that problem is definitely going to help the cause and your beard growth is going to improve. Now we know who is a good candidate for beard transplant. Another important criteria is donor. If you don't have good donor area in the scalp, and if you don't have a good hair in the scalp, in the frontal hair region, then again that is a problem. If you have a strong family history of baldness, and by the age of 30 years most of the people in your family they go bald, you are not a good candidate for beard restoration because you have to prioritize it. In case you want, you have to plan it, whether you want hair on the scalp or in the beard. That's very important. You have to think about that. Okay. Then again, important point, like who are the patients who are not good candidates for beard restoration? There is a condition called alopecia areata where you get small tiny patches in the beard area. There can be a single patch, there can be multiple patches, or sometimes the whole beard area, or sometimes all the body hair can be affected. So this is an autoimmune disorder where your body's own tissues, own antibodies, they destroy your hair, they treat it as a foreign body. So in such cases, when we do a hair restoration surgery, there are chances that it might reject those grafts, and if we take out hair from the donor area, it can sometimes initiate that alopecia areata patch even in the donor area also. So you might lose hair from the donor and you may not get any hair in the beard. So in such cases, usually we recommend a test patch of 100 hair or maybe 50 hair. Wait for some time, see that the disease is kind of stabilized, though there is no definition of stability, but gold standard criteria is wait for at least 1 year. There is another condition called pseudopelade or scarring alopecia. It is commonly seen in a problem called lichen planus. Now this condition, you can have scarring in this area. Sometimes the scalp area is also involved. This is again an autoimmune disorder, so one has to be very very careful while doing surgery in such cases. Sometimes besides natural hair transplant, there are options of synthetic hair implant also. I have made lot of videos on synthetic hair implants, how does it work. See, I've been doing synthetic hair implants since 2003, so it's almost now 17-18 years, and I have a vast experience with synthetic hair implant. But yes, if you are having an autoimmune disorder, then generally the chances of rejection in synthetic hair implants become high. So I have given links of synthetic hair implants. You can see it in the description, and uh, you know just go through the channel, my YouTube channel. There are more than 200 videos on covering almost each and every aspect of hair restoration, hair loss. So scarring alopecia is another indication where we have to be careful. Then there is a condition called trichotillomania, where patient has an urge to pull out the hair, though it is more commonly seen in females, but it can affect males also. And such patients can just, they just keep on pulling out their hair. Initially this is a reversible condition, there is no need of transplant. These hair come back at their own. If a person stops doing this, he'll have full growth, but if it is repeated too often, then it can lead to permanent scarring. And in such patients, hair restoration surgery can be considered, but only if the primary disease is under control. There is another condition called traction alopecia, which is very common in sick patients who wear turban, who tie their beards, and because of traction, these hair are lost. Now in the initial phase, it is again temporary. These hair can come back once the traction part is taken away, but over a period of time, many years, this becomes permanent and irreversible. Now hair can be implanted in this area, but as seen in all the scarring alopecias, there is a little chance of rejection. So in such cases, generally we recommend a small test patch, but in this case, still we can go ahead with the surgery in the first go itself. A very good case for hair restoration, but one has to be very careful that they don't put the traction again, at least in that amount. So I hope the video was useful to you, and if you like the video, please share it with your friends who might need it. You can ask your questions, though I have tried to answer almost all the questions on this topic, but still some questions might be unanswered. So you can ask those questions in the comment section, or you can ask those questions at the given numbers also. Me and my team will try to help, and we'll try to give all the answers. You can also follow me on Facebook and Instagram. And thanks for watching the video. Love yourself. Stay blessed.